Hi, my name is Yandira Figueroa, and today I will be presenting female genital mutilation, also known as FGM. So, what is female genital mutilation? Female genital mutilation, FGM, is the cutting of female genital by razor or knife. It is defined as a traditional practice. This is considered in many cultures as a rite of passage to womanhood, and the practice is mostly carried out by traditional circumcisers who often play other central roles in the community, like attending childbirths. Most of the time, these are not actual clinicians who are cutting girls underage, and it's considered a violation of rights for children. FGM is also considered a gender based violence for human rights, and the World Health Organization notes that 28 countries in Africa are currently still practicing FGM. And it was found in 2016 by UNICEF that at least 200 million women and girls alive today have been subjected to the practice worldwide. So there are four different types of FGM. We have type 1, which is the total or partial removal of the clitoris, as shown in the image right there. Also, I want to note that the reason why the razor blade is there is because a lot of these women who are cutting girls are using razor blades in most cases, and in some cases, knives, as I mentioned in the previous slide. Type 2 is the removal of the clitoris and portion of all the labia minora, as seen here. Type 3 is usually the most gruesome one. It is the total or partial removal of the labia minora and majora, and then they're sewn together, and they only leave a small opening or for urination and menstruation. And type 3 is one of the ones that causes the most. While they all cause complications, type 3 is the one that causes the most complications in women. Type 4 includes any harmful procedure to the female genitalia that is not for medical purposes. And the type of procedure performed also varies mainly with ethnicity. So FGM estimates per type. The World Health Organization estimated survey from women older than 15 years old to indicate the average cases per type of FGM. So it was found that around 90% of cases are type 1, 2, or 4, and type 3 accounts for 10% of the cases, which means that over 8 million women currently are cut by type 3. And type 3 is the most severe form, as I mentioned, and is mostly practiced in northeastern region of Africa. Some complications of FGM are women are subjected to FGM and they're at a greater risk for obstetric outcomes. This happens, for example, if you were to have a woman who's type 3 FGM and she was already cut and sewn, the woman would have to be uncut, unsewn, and then cut open for her to be able to have any sexual experience or also to give birth. So infants who are born to mothers who have been cut are more likely to be born stillbirth and have a high rate of neonate mortality. The complications are huge. They vary from bleeding, swelling, urine retention due to the fact that there's such a small opening in some of the cases, as well as like association with pain. And mainly the pain is when urinating, or also pain in sexual encounters, also when giving birth. There's other complications such as having shock, mental capacitation is already having like problems with, seeing yourself as whole, as well as having hemorrhage, tetanus, infections due to the cutting with surgical procedures that should not even be considered surgical procedures because they're not done by someone who is an actual professional. So there's wound infection, and there's fever, and blood poisoning. All types of FGM, but particular type 3, have been found associated with issues of reproductive health, which means that there's been childbirth complications as well as infertility and cervical cancer found in women who have been subjected to this practice. So there was a study conducted in Egypt where I found that in Egypt, FGM is actually illegal. It was found that 1,723 interviewed university girls, which accumulates to, out of those women, 815 were circumcised in 2018. Students residing in rural areas and with illiterate parents were more likely to experience FGM. So a lot of these girls, their parents are the ones that push them to get this done due to the fact that it is considered a cultural tradition. And most girls from the study in uncircumcised group, which were 98.2%, or even in the circumcised group, which was 73.5%, believe that FGM should not be justified. And again, FGM is a violation to human rights, and it's also a child neglect and abuse to women and girls. And currently there's 500,000 women in the United States who have been cut by FGM, whether it's type 1, 2, 3, or 4. It is prevalent in the United States due to the fact that I mentioned a lot of the parents send their kids to other countries for them to be cut. So I wanted to discuss and show a map that shows the prevalence of the regions where FGM is being practiced currently and is used as a tradition. You can see on the map, there's a distinction to tell the ones that are above 80%, which means that the variations in these countries, their prevalence rate is over 80% in 8 countries. And these are the percentage of girls that were 15 to 49 years old who had undergone FGM. So pattern trends over time by FGM. So the trend in the prevalence of FGM among children within 0 to 14 age range who have been subjected to FGM is shown here on the right in the graph. The percentage decline in the prevalence of FGM among children was the highest in East Africa. As we can see, East Africa is right here, starting from 1996. The prevalence decreased from 71.4% in 1995 to 8% in 2006 in East Africa. In North Africa, shown here, the percentage decreased from 57% in 1990 to 14.1% in 2015. And in West Africa, the prevalence decreased. West Africa, we see here in blue, it actually decreased from 73.6% in 1996 to 25.4% in 2017. So this has to be contrasted with Western Asia. Western Asia can be seen here. Western Asia, the percentage increased only by 1% in 1997 and 15.9% in 2013. So the results of this trend show that there's a significant downward shift in the prevalence of FGM among the children from ages 0 to 14 in these regions of Africa, mostly for those in East Africa, North Africa, and West Africa. East Africa did experience a much faster decrease in the prevalence of the practice, but by contrast, we do have to speak on the much slower decline of North and West Africa. As you can tell from the graph, there are significant improvements in FGM, but there's still countries that continue to practice FGM like Western Asia between 1997 and 2015 among children, those 0 to 14 increased more than 19.2 per year. And it also, we can see that there's a significantly uptrend for Central Africa, which is placed right here in red. So patterns over time, I thought it would be important to discuss how FGM has been viewed over the time period that it's been happening. The UN in 1958 depicted that FGM is a custom-involved ritual practice. In 1970, FGM was categorized as a harmful effect on women and girls. In 1997, there was a lot of efforts to decrease FGM, a lot of research and involvement in communities to be able to change the policy. In 2013, UNICEF defined FGM as a discrimination of human rights, risk prevention for girls, for sexual, reproductive, and maternal health for women. And in 2018, the World Health Organization launched a handbook, which was a improvement of how to deal with a case-to-case basis of a woman who might be cut or who has been cut. So right now, FGM is recognized internationally as a violation of human rights for women and girls. And it is honestly reflected rooted in sex, and it's extremely a form of discrimination against women. So some FGM inaccuracies. FGM is considered a religious practice. There is no religion that approves the mutilation of a woman's body. The religion script is said to practice FGM. There are some religious leaders who may have promoted or consider it irrelevant to their religion, and some even advocate for the elimination. So there's no specific religion that says and approves that this is something that should be practiced. FGM makes a woman clean. A lot of the thoughts that these communities have in West Africa or Africa overall is that the clitoris is an area where it's dirty and it should be eliminated. But in fact, it increases infertility, infection, STI, or HIV. It is also believed that FGM helps women give birth, and that it's better for the baby. But we have a lot of studies that show that women have a greater risk of certain outcomes, including having C-sections and postpartum hemorrhage. So another inaccuracy is that FGM is a rite of passage to womanhood. It is not. It is seen as an act to control a woman's sexual organs, and it is also seen as a child neglect. And it is also a form to have women be considered of value. It is also seen as, if you've been cut, then you're therefore pure and you are worth to be married. So, theoretical causes of why FGM still occurs is a mixture of culture practices, religious practices. Again, there's no specific religion that is saying that they should do this. It's just something that's been happening in their culture for so long that they believe it's something religious, but it's really not. And no one really wants to debunk that idea. Social factors, so a lot of communities, so if the mother has been cut, usually the child will be cut as well. And also a lot of these stories that I've read, so the girls who are actually cut, as when they're girls, they still remember what happened to them, and they realize that the people who are holding them down to have this procedure are the women in her life, like her mother, usually the mother or the aunt or the cousins are the ones who are restricting or holding the girl down as the procedure is being happening to them without them having an actual idea of what actual not having an actual idea what's going to happen to them in the future, or anything at all during that time during the cutting. So other reasons why they do this is due to hygiene. They expect someone to be cut because it makes you cleaner, helps you reproductively and sexually. And as far as sexually, it is honestly due to reduce a woman's libido. It is considered to resist her from engaging in sexual intercourse. And all of these reasons are obviously non-evidence based. A lot of this has to do with pressure to conform to their traditional practice, as I mentioned. And honestly, if women do not depart from the social norm, unfortunately, what happens is they are rejected by their community and they're left alone a lot of the times. So etiology of FGM is often linked with virginity and being faithful during marriage. So as I mentioned, if you are cut, then therefore you are considered a virgin and then considered pure, and therefore you are good enough to get married. And um, there's a value to being cut in these communities. The damage to the genitalia means that the chance of women having painful sexual relations. There have been a lot of women who have been surveyed and have had complications during being intimate with their partners. Also, the purpose of female genital relations is to control women's sexuality. This was done to control women to stay pure, to stay a virgin until they were married. It is also claimed that the female genitalia is ugly or dirty. There's also been cases where it has been compared to a man's circumcision, and it's not the same thing. This is, again, like I've explained and I've showed in images, it's not the same thing. It's a control to control women's sexuality. And it is seen by some of the rite passages as a condition for womanhood. So as a girl, usually if I go from a girl to a woman, you're considered like, in my culture is usually like you have a big party and you have all your family. But here in this culture, what they do is they cut you. So really think about that. So there's a common belief that women need to have FGM to have babies. And again, this has been debunked previously. It actually brings a lot of complications. So for diagnosis and treatment, the clinician would diagnose on a case-to-case basis in order to understand a woman's culture and also her views on FGM. There has been a lot of opportunities to identify FGM, but unfortunately they're always missed. A lot of the times it might be hard to have that conversation with a patient without really crossing some boundaries, due to the fact that FGM is seen as a religious practice, and that idea has not been debunked. A lot of clinicians probably either miss or not sure how to address FGM in order to have a conversation with their clinicians. So that diagnosis has been quite hard for these cases. As far as treatment, there has been surgeries that can be performed to open the vagina. And I've mentioned if necessary, and this has to do with the type 3. As I mentioned, since they're sewing the leva minora and majora together, and only leaving a small opening for urination and menstruation, women are usually opened for marriage and also when giving birth. So the surgery can be performed to open the vagina if necessary, or if a woman would like to, have that procedure done, whether or not they're having a baby or having sexual intercourse. So there is a reversal procedure, but it does not replace the removed tissue that was already taken out. and it doesn't really undo the damage or the mental ability that a woman has already gone through. Um, Also, the reconstruction surgery can potentially help improve sexual function by removing the scar tissue from the previous cut. So some of the risk factors are girls who are 9 to 11 years old, and I should also mention that this could happen to infants as well. It does not just mean there's no specific age. I have seen some studies where babies were already cut, and also a lot of girls die during the procedure. Also, the lack of education driven by religion or tradition, the place of residence. Obviously, if you're in those countries who are still practicing in Africa, your prevalence is pretty high. But I think this could go either way, because even if you're not living in residence, but if you still are lack of education and you're still in the United States and sending your kid out to get cut, it could also be another factor. Also, your socioeconomic status, that has to do with when a girl is cut, then they're worth something, and then whoever is marrying this girl could potentially give the family some sort of reward or money or help them socioeconomically, and it's a huge risk factor. Also, maternal education and ethnicity. So a protective factor is FGM is protected against stigma and isolation for circumcised girls. A lot of women who have spoken out against FGM have explained that those who have not been cut have been isolated from um, their communities, and it is very hard as a girl growing up to see other girls not want to play with you because you were not cut, and therefore the reason why FGM continues is due to the fact that it is so normalized in a lot of these places. FGM is used to increase our worth during marriage is another cause, a protective factor. If you get cut, you get married, your family's happy, you live in your community. The end. Family and community inclusion, again, is another protective factor. They're not considering the side effects and the aftermath of what it is like to be cut. And a lot of these girls probably won't see any of these issues until until they have to be married and give birth. So preventions for FGM is that there needs to be change on the need to control female sexuality. And also, we need to discuss with communities on the disadvantages of FGM. We need to educate girls that they have a right to decide for their own what happens to their body. We need to change traditions, or at least discuss, acknowledge that religion does not demand FGM, and then speak out on risk and aftermaths of FGM. So the cost of treating health complications for FGM in 28 countries totaled $1.4 billion in 1 year. And this was a study that was found by the World Health Organization. And it was expected to rise to 2.3 billion in 30 years. And this would decrease at 60% over the next 30 years if all countries were to stop the practice. There was also a survey done by the World Health Organization in 6 African countries who still conduct the practice. And then the study was found that compared those women who were giving birth, the excess infant death attributed to FGM ranged from 11 to 17 per 1,000 deliveries, and 8% of those who were born alive, the babies had to be resuscitated, and the 5% were stillborn or died in the immediate postnatal period. Also, it was found that those women were bleeding a lot more, and they were also hemorrhaging and dying a lot more, um, than compared to those who did not get cut. And there was a greater risk for these women who were getting C-sections and compared to those who were not. Some controversies for FGM is that it is a cultural practice, a traditional rite of passage, as I mentioned. It should not be considered that. It is not like the male circumcision. FGM is only practiced in Africa. I explained that a lot of women who are living in the United States are still being cut. So it's not just in Africa. Many studies have found that those victimized with FGM have lived in the United States and then were sent to their third world countries by their parents to get this procedure. Therefore, FGM makes a woman clean and improves sexual behavior. This is another controversy. FGM does not harm women or child, and FGM protects virginity and familial honor. These are some of the limitations and probably reasons why FGM still has not been decreased worldwide. It has to do with language barriers, and also cultural barriers. Insecure immigration status. If there's a girl who has had this procedure and wants to, I guess, have a doctor look at this procedure and may have some questions on how to reverse the procedure, then if their immigration status, therefore they're most likely to seek health assistance due to the fact that they feel like no one's really out to help them. Also, they might be ashamed or maybe stigmatized by isolation from their communities, which means that there's a lot of social factors in this cutting procedure. It's also association with a religion aspect, as I mentioned. They don't want to be considered that their religion is what made them being cut as a child. So some of my recommendations for FGM is that there's need for healthcare across the world. So what I mean by this is we need to provide girls and women who have undergone FGM with proper healthcare education. Not only that, but we need to have clinicians who are able to assist a girl and inform on any health consequences that FGM may and will develop. Educate the community and healthcare providers to stop performing FGM, especially also the women who are performing these procedures, who are not healthcare providers. They need to be spoken about and discussed. I think it would be also good to have someone from their own community who has not been cut, who has been cut, and discuss their negative factors of how they have been living with being cut and any complications that they may have had. I think it would be helpful in these to decrease the prevalence of FGM. Also, create a protocol when dealing with a potential case of FGM. There needs to be sexual health counseling, speaking to girls in schools and communities to understand what happens to them when they're cut and what could happen to them in the future. Also, and empower girls and women to advocate for rights to their own bodies and educate physical and mental health complications that could occur due to this practice. And I think there's already a lot of improvement in this topic, but there's a lot more that could be done, as we saw a lot of the recommendations and also the public health aspect that FGM needs to be stopped, not only for as a woman, but also as someone who eventually would want to improve healthcare. FGM is still considered a practice and therefore should be stopped. Thank you, and these are my references. and hope you have a great day.